Florida TMS Clinic provides cutting-edge medical technology for treatment of depression. We basically provide transcranial magnetic stimulation in which we stimulate the dorsolateral prefrontal cortex, which is an area of the brain that is connected to the limbic system that controls our emotions, our fear centers, our promotion center, our motivation centers. And if we stimulate that area of the brain consistently for a certain number of sessions, then patients will come out of their depression. And that's what we practice here at Florida TMS Clinic. We use the most advanced technology in this field, which is navigated TMS. We're the only one in Tampa Bay area that does have navigated TMS, which increases the accuracy of the treatment and the consistency of the treatment throughout the sessions. There are a few problems with treating depression with medications. Number one, it's not that effective. And the more that we know about antidepressants and depression, the more that we know how ineffective some medications are. Especially when patient had failed a medication or more, then the chances of them responding to another antidepressant trial goes down pretty significantly. Number two, which is for a lot of people is more important, is that medications do have side effects. People put on weight when they're on antidepressants. People might have sexual side effects when they're on antidepressants. You might have GI or stomach side effects, nausea, diarrhea, etc. Some people might have lightheadedness. Some people might have headache with medications. So medicines always come with a cost. While when you're doing TMS, the only side effect that you're dealing with is some discomfort on the scalp when you're doing the treatment, but there is no systemic side effect. We also try to make TMS affordable for patients. So we actually charge the cost per remission rather than charging the money or what other insurances will pay us. So we try to cut the cost of TMS to the least possible so patients can afford it and they can elect for it and not stay away from it because of how expensive it is. So there is no referral process particularly. Any patient can contact us and we will help them throughout the prior authorization with their insurance. So if a referral comes from another psychiatrist or a family physician, we definitely will follow through that. But if a patient wants to contact our clinic directly, then that also works out. You know what we do a free consultation when the patient comes in. We do a full psychiatric evaluation. And sometimes we could tell the patient that TMS is not the right step for them, and we will direct them to what to do next. And that's all for free. But even after that, if we thought that TMS is the right treatment for the patient, then we will contact their insurance and we'll try to fight for them to get prior authorization. And once we get the prior authorization done, then patient can start their treatments. If you have been suffering from depression for a long time and you have tried many medications before, with failures of those medications not helping or causing so much side effect, I think you owe it to yourself to look into the alternative of TMS. But I would like to talk with anybody in this area who's interested in TMS just to give them the education. So I think you owe it to yourself to learn a little bit more about TMS and see if that's the right next step for you. Your happiness, your quality of life, it's I think the most important thing that people should be thinking about, and we can't just postpone on that. We have to get better, and we have to get better now.